Cam is currently a compression therapy consultant. He is an ambassador for LE&RN, and he's going to speak to you about when is pumping recommended. He actually joined us live in 2019. He was our guest speaker, and he actually has primary lymphedema in his leg. His disease brought him closer to opportunities for managed care, which of course now brought him to be a compression therapy consultant and expert in pumps. So Cam's going to walk us through what he knows about the effects and benefits of pumping, followed by a live demo of what a pump looks like, its features and benefits. So Cam, welcome.
Okay, hello, howdy, as we say here in Texas. Really excited that you guys are all tuning in virtually for this amazing event, the Boston Lymphatic Patient Symposium. It's hard to believe that it's been over 2 years since I was last presenting at a patient symposium in Boston. So really excited to be here virtually with you guys all. I'm going to speak somewhat fast. I know we have about 20 minutes and want to leave some time at the end for Q&A. So I'm looking forward to that. So without further ado, we're going to get started. And I'm going to be back and forth between talking to you guys and sharing some slides. So let's get to it. Everyone, to pump or not to pump? That is the question. That is from Camlet. No, not Shakespearean's Hamlet, but a little play on words there for you. And so that's what we're going to be discussing today is using pneumatic compression devices, compression pumps for the treatment of lymphedema, lipedema, and venous disease. A little bit about myself, for those of you who may not have met me. My name is Cam Ayala, and I am a primary lymphedema patient. I'm an ambassador with LE&RN, and I'm also a compression therapy consultant. So now for everyone's favorite part, little housekeeping rules and disclaimer. So my disclaimers are: 1, I am not a medical doctor, nor am I a certified lymphedema therapist. I do, however, work for a pneumatic compression device manufacturer, but for this particular presentation, I want to keep it pretty unbiased and generic in nature. That way I'm not swaying anybody either which way. But ultimately, before we get into this and before you start going on this path of potentially trialing or evaluating pneumatic compression devices, just make sure that you consult with your care team, whether it's your physician or your lymphedema therapist, prior to just going online and purchasing a lymphedema pump on Amazon or eBay, for example. So those are my only disclaimers. And high level, here is what we are going to be covering. What pneumatic compression is, who pneumatic compression is for, plus some of those applications, and then who pneumatic compression is not for, and some of the contraindications that are involved in that. So let me just toggle back here. Okay, so let's just start so we're all on the same page of the definition of what a pneumatic compression device is. So you're going to hear me say PCD or pump throughout the conversation and through the presentation. So just know that that's what that stands for. So high level definition: pneumatic compression devices consist of an inflatable garment for the arm or leg and an electrical pneumatic pump that fills the garment with compressed air. The garment is intermittently inflated and deflated with cycle times and pressures that vary between devices. And that came from CMS.com, so Center for Medicare and Medicaid Services. So again, that's just kind of a high level definition. You may have heard them called pumps. You may have heard it just being named by the actual manufacturer. And again, the purpose of this is to not go through all of the different manufacturers and talk about what makes one better or different from one to the next. I just want a high level kind of talk about pneumatic compression. For many of you who are new lymphedema or lipedema patients, I understand that this can be pretty overwhelming. You know, they say it's like drinking from a fire hose with all the information that's thrown at you. You know, perhaps your lymphedema is secondary to a cancer battle that you've had, or maybe your lymphedema, like mine, is hereditary. So you've been dealing with it for many, many years, right? So wherever you're at in your lymphedema or lipedema journey, just know that now's as good a time as it's ever been to you know, join this community, have great support groups, a lot of great information, but also caution you that there's a lot of misinformation out there on the interwebs. So make sure that you have a good support team there locally wherever you reside. So hopefully consisting of a good physician, whether it's a primary care physician or a wound care doctor, podiatrist, cardiovascular doctor, or even a plastic surgeon who may be specializing in lymphatic surgeries. And like I said, a lymphedema therapist, if you're fortunate enough to have one there in your community. So it's important to have kind of the A team, if you will, of individuals who can assess you, diagnose you, and ultimately come up with a comprehensive treatment plan that is catered and tailored to you. Right? You've heard this saying before, I'm sure. Lymphedema is not a one-size-fits-all condition, right? There's different parts of the body that can be impaired and impacted. The onset is different from patient to patient. The severity is different from patient to patient. And a lot of patients may have other comorbidities or pre-existing conditions that need to be taken into consideration when determining what's the best treatment protocol for you as the individual. So, okay, so let's go back to some of the slides here. Okay, so one of the most common questions that a lot of patients have is just the overall coverage of pneumatic compression devices, right? So believe it or not, it is covered by most insurances, such as Medicare and Medicaid. But when we start looking at the private insurance providers, you know, that's going to depend from each provider and individual policies that those providers have, right? So they have different coverage options. And ultimately, in order to be covered, there's different documentation requirements to get those pneumatic compression devices approved. So typically, I like to tell most patients, if we're using kind of the high level approach from a documentation, most insurance providers are going to require at least 28 days, right? A minimum of 28 days of you trying this conservative care. And conservative care consists of things like compression modalities, whether you're being bandaged or wrapped in clinic, or maybe they have you wearing compression garments already. Things like elevation of the extremity that's affected, if appropriate, and different exercises that are, you know, important to, you know, helping to get that affected extremity down to a manageable size as much as possible. So also know that, unfortunately, you know, a lymphedema therapist can't be the only one who provides the documentation. Because pneumatic compression devices are considered durable medical equipment, it does require a signature on the prescription from a physician. So that can be your primary care physician, a nurse practitioner, or any other specialty MD that is aware of your condition. And then even measurements of severity, which you'll probably learn in other sessions about the different stagings of lymphedema or lipedema, and even things like having circumference measurements of your affected extremities. So one thing that's been surprising to me as a patient managing my lymphedema since I was 11 years old, I've always been blessed and fortunate to have pretty good private insurance coverage, whether it was through my parents' employers or now through my own employer. But a thing that can be pretty disappointing for a lot of patients is there's not always or typically great coverage for compression garments. So it may be surprising to you that perhaps you're a Medicare patient, that pneumatic compression devices have better coverage in most cases than most compression garments. So it's not to say not to use your compression garments by any means, because we'll talk about that later in the presentation, but just be aware that you actually may have better coverage than you were anticipating for things like a pneumatic compression device. Okay, So to break it down even further, there are different types of PCDs, right? So starting with a basic model, and again, this is dictated by how it is coded from the insurance provider. So a basic model of a compression pump is coded at E0651. And then the more advanced models of pneumatic compression devices are coded as E0652. So keep those codes in mind, because perhaps you're contacting your insurance provider and you're saying, oh, I want a lymphedema pump, or you may even name a manufacturer. But it is important to know the different codes on there so you can be on the same page as your insurance provider. So one thing that I've mentioned before is, managing my lymphedema, especially as long as I've had, has been this ever evolving cat and mouse, chicken and egg, but mostly trial and error, right? So I've tried a multiple array of compression garments, compression pumps, different lymphedema therapists, different physicians, right? And it's, been kind of all over the place. And that being said, just on the topic of pneumatic compression devices, because there are multiple manufacturers, I do encourage you to evaluate and trial different brands while you're going through that CDT, that complete decongestive therapy, ranging anywhere from a couple of weeks up to as much as even 8 weeks or potentially longer if necessary. So talk to your local certified lymphedema therapist about the different options available to you, or your primary care or other physicians. And the reason why this is important, especially from an insurance perspective, is that most insurance companies, especially Medicare, will only authorize one pump once every 5 years. So that's a 5-year investment. And that's why I say it's important to work with your local DME, that's your durable medical equipment, or local vendors and suppliers, to kind of test drive it before you buy it. Much like you would with a car, you don't just have someone say, oh, Joe, just get a Ford just because I said so, get a Ford, right? No, you may want to test drive a Chevy or a Toyota or other models within the Ford manufacturer. So again, I do encourage you to try out as many as you can or that are available in your area, because to my last point here, much like compression garments, the same topic is applicable for pneumatic compression devices. They're not all created equal. There's a different way to don and doff the garments, right? So let me stop my screen here. Okay, so just the donning and doffing, in other words, how you put on the arm sleeve or the leg sleeve or the head and neck garment or the chest trunk, wherever your affected extremity or body parts or area that's being impacted by your lymphedema. Just know that it's important to trial maybe more than one manufacturer. Okay, so who are PCDs appropriate for? Obviously, lymphedema patients, and it doesn't really matter differentiating between like primary or hereditary lymphedema or secondary. Lipedema patients, right? So this is something you're probably hearing a lot more. Maybe you've recently been diagnosed with lipedema or lipolymphedema, as kind of having a combination of lipedema and lymphedema. And I spent a lot of time in my territory here in the greater Houston area at vein clinics with cardiovascular doctors. So patients with venous disease, such as chronic venous insufficiency or phlebolymphodema, essentially where your vascular system, your veins are so overloaded that it then spills over and carries into your lymphatic system, and then you're dealing with chronic swelling. Okay. So now we'll talk a little bit more about the applications of pneumatic compression devices. So as I kind of hinted at earlier, it can be for upper and lower extremities. It could be unilateral and bilateral, right? So maybe you just have one arm or one leg, or perhaps you have both, or maybe you have a little bit more of a global presentation of your lymphedema or lipedema. So there's other areas, right, that you can treat beyond the arms and legs, areas such as your chest. Maybe you're a breast cancer survivor, or in your groin, hips, genitalia. Maybe you've had a hysterectomy or prostate cancer or any other type of surgical intervention. Or maybe you have primary lymphedema where you are impacted in those areas of your body, and then head and neck as well. So just know that if it is available in your local clinics, you can do a demo or trial there, perhaps have a local vendor or rep come in and do that. But ultimately, pneumatic compression devices are intended for home therapy, right? This isn't something you should be doing at every single appointment with your lymphedema therapist or physician. So as you can see in this little diagram, our lymphatic system is from head to toe. So really you can be impacted anywhere. And fortunately now there are options and solutions for pneumatic compression devices to treat pretty much anywhere on your body. Okay, so you may have heard this before. PCDs are really just another tool in your toolkit. I tell all the patients that I have the privilege of working with that really it's part of this compression ecosystem, because if this is deemed appropriate for you, perhaps you have a daytime compression garment, which that can be broken down into flat knit and circular knit, or perhaps you have a nighttime compression garment like some of the foam chip materials. And depending upon your therapist or your presentation, there's some nighttime foam chip garments that are a great adjunct therapy to pneumatic compression, depending upon which pneumatic compression device that you obtain. Things like the wrapping and bandaging that is pretty heavy when you're doing the CDT part of your diagnosis and part of your management journey. And we've all heard of self-manual lymphatic drainage, right? So I tell patients that the pump does not replace the necessity to do MLD, but when used in conjunction, it can be really, really effective. And if you're anything like myself, I've actually had lymphedema surgery. So if you're a patient where lymphedema surgery is a good option for you, perhaps this would be using a pump post-surgery, if deemed appropriate, is another great way to manage and ultimately help your healing and recovery. But again, what I tell patients is this is not, pumps are not a standalone compression modality. I mean, I wish we did have a silver bullet or something to just make the lymphedema or lipedema go away, and the pump was the golden answer for that, but that's not the case, unfortunately. So again, think of this as a tool in your toolkit. And if there are any lymphedema therapists watching, I tell this to all of my patients: pumps do not replace your certified lymphedema therapists. That's actually a picture of me and one of my lymphedema therapists, Ms. Karen Ashforth. She's amazing, but Karen lives in California and I live in Texas. So I don't get to see her all the time. I don't get to take her home with me and have her do all of her incredible modalities. And therapists are amazing with educating you and keeping you up to date and monitoring you. So again, picture your pump as really, an adjunct, an extension of your therapist. Once your therapist discharges you, for example, having a good pump in place could really help you manage the condition independently. So finally, we'll talk about who pumps are not appropriate for. And this is just some high level things here. And so the first one being active infection. So, if you do have an infection such as cellulitis, which can be pretty common amongst lymphedema patients, make sure you're being cleared by your infectious disease doctor, whoever is overseeing your care, before you resume pumping. Another one is active deep vein thrombosis, DVT. So make sure, again, that you're cleared from your physician before resuming your treatments. The final one here is active congestive heart failure, CHF. And the operative word for all three of those is active, because if you have it under control and you get clearance from your cardiovascular doctor or your lymphedema therapist or whoever else is overseeing your care, I don't want you to be afraid that just because you've had an infection in the past or you've had DVT or CHF in the past, that doesn't automatically disqualify you from being eligible for a pneumatic compression device. And finally, if you're a pregnant patient, obviously we wouldn't want you to compress or treat your abdominal area during your pregnancy. But for a longer list of contraindications, definitely consult with your certified lymphedema therapist or care provider to get that extensive list. So I will now leave it open for any questions. And again, I really appreciate the opportunity to virtually chat with you all. And as I always tell patients, just keep lymphing. Take care.
Yes, I can. Yep.
Okay.
Yep. Thank you so much, Kim. That was fantastic. I see you have your Houston's hat on. Kim and I had a little friendly side bet with the Red Sox against Houston Astros, and needless to say, the Red Sox did not win. So thank you, Kim. Can you talk about some of the benefits? Like, why would somebody want to pump? Like, what are the benefits that you get out of it?
Sure. And I guess different ranges of benefits are going to vary from patient to patient. From me personally, I actually recently had a total knee replacement on my same lymphedema leg. And I know I've talked to Catherine about that a little bit in Boston recently. So one of the things, with most orthopedic procedures, you're going to have some post-operative swelling. So when you have that post-operative swelling combined with your already existing lymphedema swelling and some of the pain and neuropathy symptoms that I would have chronically, anytime while I pump, I seem to have some pain relief. And when we're moving that excess lymphatic fluid, for a lot of patients who have stiff ankles or knee joints, when it softens that tissue, you tend to have improvements in that range of motion and mobility in some of the affected areas. So, and a final kind of good application is a lot of my patients that have chronic wounds, oftentimes the underlying issue is the swelling, right? So if we can control the swelling, it actually can expedite the wound closure and the wound healing element of their management.
That's great. Is there an ideal time to pump, for example, morning versus evening?
Great question. And there are no clinical studies that indicate which time of day is more effective, right? So I just try to be realistic with my patients, because I know that sometimes waking up an extra hour early is not, conducive for a patient like, maybe Catherine, who probably wakes up pretty early to begin with, right? So if you have little ones or you already kind of start your day pretty early, I'm not telling you to wake up at 4 a.m., as opposed to 5 a.m. so you can pump an hour before the day. But as I was mentioning in one of the other slides, as long as you have all the other compression modalities in place, like your daytime and nighttime garments, I personally pump in the evening after a long day at work. That's kind of how I incorporate it into my daily routine. And then on the weekends, if there's a little bit more downtime and I don't have anything planned, then I'll, pump in the morning or mid-afternoon. So consistency is really the key, not so much the time of day that you pump, but just that you pump if that's deemed appropriate for you.
Okay, great. Thank you. I see more questions coming in, but I know we're running short on time.
Okay.
Can I just ask you one more question? We heard earlier from Dr. Broensen and talked about, the fatty tissue that develops. Is the pumping beneficial more for those that are more fluid dominant versus more fat dominant?
Great question. And short answer, no. So the particular pump company that I work for is actually FDA cleared and indicated for the treatment of lipedema as well. So a lot of lipedema patients who may have more of that fatty adipose tissue, they have seen a lot of benefits from our particular pneumatic compression device. And then I'm more fluid dominant with my lymphedema, so I feel the benefits as well. So again, it's different from patient to patient, but we have seen a lot of clinical indications for fatty as well as fluid dominant lymphedema.
That's great. That's great. Well, thank you so much, Cam. It was a pleasure speaking and seeing you today. It was great. Thank you.
Likewise. Thanks, ladies.
Bye.